Hello, everybody, and welcome. This is Banter, and we are featuring a survivor story today. My name is Jahan Corbin, and this is my friend and fellow survivor Lynn Haddad, and we are honored to be with you and to be able to facilitate this conversation. If you are not familiar with BRA, it stands for Breast Cancer Recovery in Action. And so BRA is our acronym, and we are a nonprofit based in Middle Tennessee that is first and foremost a community for people navigating breast cancer, and we provide free resources for folks who are in treatment, post-treatment, and just trying to connect with other survivors. So today we are featuring a specific survivor. She's one of our warrior women. I'm going to turn it over to my partner, Lynn, to introduce her.
Yes, welcome to Candy Hunley. And we're so happy to have you join us today.
Thank you for having me.
Yes, and I would love to take this opportunity to wish you a 20-year cancerversary. Little early, coming up
Yep.
in July, I believe. That's
It
quite
is
a
July 15th.
milestone you
Thank
have
you.
coming up. So,
Yep.
and I believe you're also a grandmother.
I am. I have two little granddaughters, Eloise and Fiona. They're 1 and 3.
Oh,
They're my heart.
you
Your whole
mentioned
world.
that your heart is in Paris, but those names go perfectly.
Oh, I know. I know it.
We were meant to go to
I
Paris.
love those names. Eloise and Fiona. That's awesome. What do they call you? What's your grandmother name?
Gigi.
Gigi. So
Gigi.
cute.
Oh, it should be blonde math. Um,
Oh, it's just, oh yeah. And then they FaceTime every day and it's just like, oh, it's so precious.
When are they coming home? How much longer do you have to wait?
2 weeks.
Oh my
They've only been
goodness.
gone a week. Yeah.
right. Nice little vacation. That's good. Actually, then they'll have time to acclimate there. So that's
Yes. Oh, they're already in their second city. They're fine.
Oh, to be
It's
honest,
me. It's me. What about me? What about Gigi over here?
right.
All right. Well, if you could just take a minute and walk us through your diagnosis a little bit and share how that went for you.
So I was 36. I had no family history at all. I had found a lump in the shower and I knew right away. I'm like, yeah, that's cancer. I just knew. And it just felt different. I remember always hearing that the history that I'd heard was it would feel like a hard pea. And for me, it did not. Mine felt like a soft nickel, which is it was like the size of a nickel, but it was very soft. It was never a hard, never felt hard tissue for
Yeah.
me. And I remember I went to my doctor and he's like, yeah, but let's just go ahead and have it checked out. So I went through all the processes and they did the needle core biopsy. And immediately when you get called back, you're like, okay.
Mhm.
So my husband and I went, and you go in, and I felt like he waited until I was the last patient of the day for a reason,
Uh-huh.
to give you that news. And you just sit there and you're hearing words, you don't even know what these words are. They were talking about sentinel node and just so many different words. You're just like, I don't even know what these are. So you go home and your mind is muddled and fuzzled and then at the time, 20 years ago in 2005, I mean, I literally went to Barnes and Noble and I just got breast cancer books. I had no idea. There was like no internet stuff. There wasn't searching. And I just started researching, just understanding the different types of surgeries, what I was about to go through. And I did a bilateral mastectomy with reconstruction. I did the expanders.
Mhm.
And then after that, they staged me after they got pathology back, and I was stage 3B.
Uh-huh.
So I had a very large tumor, and I had positive lymph nodes, and
Uh-huh.
it was very aggressive. Once it was, the pathology came back, so they immediately, I mean, it was like you hit the ground running, and immediately it was, chemo was, you don't wait. It is, you don't pass go, you go. And so it was immediately go to chemo.
Mhm.
And I did the AC adriamycin, which is the Red Devil, Cytoxan, and Taxotere, the ACT
Mhm.
regimen for me. And so I did, oh gosh, I think 16 rounds of that. And it was terrible. Finished that, and they gave me a couple months and said, okay, now we're going to do radiation. So I did 36 rounds of radiation, and then 5 years of tamoxifen.
Mhm.
And but I am here 20 years later, so it worked for me, and I'm just able and wanting to help other women, and any questions, anything that helped me through my journey to help another woman, I would, love to talk to anyone.
Yeah,
Yeah.
well, we appreciate it. And that's one reason it's so impactful to record these kinds of stories and share with one another our experiences. I was not quite as young as you, Candy. I had just turned 41, but
Mhm.
through all of that too, with the idea, I think that they are so aggressive. Not only did you have an aggressive kind of cancer, but just your young age at diagnosis. My
Yes.
oncologist explained to me that was something that he really felt like was a motivating factor in doing all the things. Because
Hmm.
if you're 70, it's like you can take the risk. You only have maybe 25, 30 more years to,
Right.
but when
Right.
you're 40 or 35,
Hmm.
it's a different story. So
Yeah,
and I can only imagine how hard that was with three young kids. Did you have a lot of support? Did your
I
community
did.
around you at that time?
Oh,
Okay.
I did. My family and friends and church, and absolutely. I mean, they would just take the kids for, a couple days at a time, and they would pick them up from school. We'd have meals delivered. We were surrounded by just so much love and help, and it was wonderful.
Yeah.
I can't imagine.
Yeah,
Yeah,
that's
just being just having someone to help, and the kids at that age, my youngest was going into kindergarten, and we found we were going through some old, people don't have photo albums, but back in the day we had photo albums.
Right. Uh-huh.
And we
right.
were going through photo albums, and I found a picture of his kindergarten, his very first day of kindergarten. So I was diagnosed, my surgery was in July, and he started kindergarten like what, mid-August. And I found this picture. My husband had dressed him because I was completely out of it.
Right.
And
Right.
I think he had stripes on and plaid pants, but it was hilarious. And I'm
Right.
just like, okay, well, that it
Just
worked.
gonna let that
It's
go.
fine.
He got to school just fine.
You just know what
Absolutely. Yeah.
happened that day.
It's funny because my youngest was also 5 and in kindergarten when I was diagnosed. And when I ask him now, he's 12 now. When I ask him now, like, what do you remember about that time? He'll say, because kids are so resilient. I
Mhm.
worried to death
Right.
about them. I
Yeah.
worried
Oh,
about all
oh,
the ways they were
Yeah.
being impacted and all the things.
yes,
And my
yes.
older two remember a little bit more, but he will say, I just remember that we watched a lot of movies and I had
Yeah.
a lot of play
Hmm.
dates and like my
Hmm.
grandparents were here a lot. he
Hmm.
has all good memories,
Yeah.
Yes. Yeah.
which
Yeah.
is a blessing. I'm very thankful.
Yeah, yeah. Well, I remember I think it was I don't know if it was my middle or oldest daughter. They were 7 and 9, and I lost my hair, and that
Right.
was a big, big
Mhm.
thing going into the school, and
Right.
and just helping out. I was one of the room moms, so I would go in and help, and I never did a wig. I just never did. I did a bandana, whatever color shirt I wore that day, that's the color bandana I wore.
Yeah.
Um, and it was just for me, it was just I was able to try to do my normal routine with the kids. I would just try to be there, pick them up from school, drive, as I could.
Right.
Um, but I remember there was a couple different times that they were very concerned, mom's going to lose her hair and what's that look like?
Mm.
Yeah.
But it, there that's the least of anyone's concern,
Right.
Right.
Yeah.
Right.
No, actually, so one of my sons did not like the way I looked when I was not wearing a wig. And we were
Oh,
living in Tampa at the time. It was very warm in Tampa. And that wig was so hot.
Yeah.
I hated the
yes.
wig. But I would keep a wig in the car in case I had to get out at school. The rest
Uh-huh.
of the time, I was either bald or I had like
Yeah.
a chemo beanie.
Yeah.
Because
Hmm.
I didn't want to wear it. But one of them, oh, he just could not stand it. He didn't want me to look like that, you know.
Oh,
Everybody
yeah.
at school knew what was happening, but it really bothered him.
Hmm.
You just don't know how they're going to respond.
No, you don't. Mm-mm.
Yeah.
And it's just
Mhm.
such a unique experience. Not only are you worried about your own health and you're going through this battle
Yeah.
for your life, but then when you've got young children, it is
Yeah.
that mama concern that we
Right.
all have built in, worrying about how they're responding to it. I would imagine, and you mentioned like just in 2005, not having the resources. Certainly, this was before social media, and we
Mhm.
weren't quite as connected via the iPhone and all that as we are
Mhm.
now. Was there any time that you felt isolated at all, or were you
Yeah.
able to find other young survivors to
No, I never found other young survivors. I really didn't. I mean, my surgeon, my nurse navigator just gave me, you know, I actually, there was one girl for my church. It was a lady I went to church with, her daughter.
Mhm.
I actually talked to her, and we're actually still friends to this day. And she was a young survivor herself. But other than that, there was just not, it really what there wasn't, there wasn't many, that
Yeah.
I could relate to, that I could,
Right.
talk to.
It was hard, I would imagine.
It was, yeah.
In our broad groups, in our small group discussions, we find that many of us had a lot of support. We had family, we had friends. But
Mhm.
when there are certain things when talking about our experience with cancer that other survivors seem to be able to understand better
Mhm.
than people who haven't walked down that road. So
Right.
how were you able to come to terms with the emotional aspects if you weren't able to have a cancer community, so to speak?
I think just being surrounded by family and, prayer and friends,
Yeah.
I just really leaned on them. And, I think also just staying busy with the kids. It was, three kids. I think I was just in go mode,
Yeah.
Yeah.
just go, and then once and that was in '05. And I went to Pretty in Pink, which is a breast cancer boutique in Franklin, and I went to them as a resource because I needed help after my reconstruction. I was not symmetrical. I was just having issues, and my nurse navigator said, "Well, go check them out," and I did, and that led me down that path to, I met the owner, and then I actually a few years after that I went to work for them, and that actually gave me a lot of resources as well that I was able to tap into and just talk to other women in that community.
Who had gone through the same thing.
Yeah.
Yeah, that was
Yes.
maybe
Yeah.
that was kind of your emotional
That's where you
recovery,
found your community.
sort of
It
hour
is.
later.
Absolutely.
That's sort of who you
How
found.
long was it between going through reconstruction and going into Pretty in Pink?
About 5 years.
5 years.
Wow.
Oh, that was a
Hmm.
while.
Yeah.
Yeah.
Well,
Hmm.
I understand what you mean though. Three kids,
Yeah.
that is a pretty big distraction. It's
Yeah.
just
Yes.
trying to keep everybody alive,
Yeah.
and just keep on going and do the things.
Hmm.
So,
Yeah. And my husband had a construction company and I was doing all the accounting. So it's
Yeah.
just like, we're just, it was just like survival and
we're busy,
we're
right?
just busy.
Yeah.
Hmm.
Well, so looking back on your experience, and now, I mean, you're coming up on this big anniversary. 20 years is fantastic. I wonder if this is a two-part question. I wonder if your anniversary, cancer anniversary, does it how do you feel about it as you approach it? Does it trigger anything in you? Is it what is that like for you? Is it more gratitude or just more reflecting on how difficult that time was or something else? And then my other part of the question would be like going back 20 years, if you could know something then that you know now, what would it
Hmm.
be? What advice would you have given yourself if you knew all you know now, 20 years
Yeah.
later?
Well, the first part of the question, I think I definitely feel pride. I think I'm very proud of, you know, just getting through what I did and also just in the business I'm in now, being able to help women for the 11 years I was with another company and then doing what I'm doing now. Just I think that is, I just feel very proud of myself
Great.
for helping and just being available and open to help other women, you know.
Yeah,
So
that's
that's been amazing. And what was the second one?
what
Oh,
advice
what would I do different? Sorry.
Multiple
yeah,
questions.
sorry, I'm sorry. I have to say it while I'm thinking about it or I forget. That's
Yeah.
Oh
my
no, no, I get it. You know, I think it's kind of twofold. I think it's so important. I did not get a second opinion, and I wouldn't change a thing as far as, the cancer's out. I'm doing great 20 years later. But I think it's really important for women to take just a second, if you can, to get a second opinion, just to make sure you've looked at every option, whether it's reconstruction, whether it's a different surgeon, whether it's, pathology. Just look at all the options. And then also, if you decide not to do reconstruction, knowing what the options are, because I I was in such a, the breast surgeon and then the plastic surgeon at the time, I was just like in a tunnel vision of just go. I wasn't questioning, I was trusting, I was believing, and I did, and I'm here. But looking back now, what I know, would I have done the same reconstruction? Would I have done I don't know. I would have maybe researched a little bit more. If I didn't do reconstruction and I did them, I would definitely do the mastectomy.
yeah,
That's not a
Yeah.
right,
that's a given.
right.
Yeah.
But would I have done reconstruction?
Maybe
no
not.
one gave me an option to say, if you don't do reconstruction, you could use a prosthesis.
Yeah.
What's that? I don't even know what that word was. I didn't even know
Yeah.
what in the world they're talking about. But what I know now, I mean, the reconstruction for me, the expanders was very painful,
Yeah.
that process, and then you've got to go through the swap surgery, and if there was a chance of infection, all of those things I didn't know. I was just like trusting and go, go, go. And I had a much older plastic surgeon gentleman, and he was, I don't want to, I mean, this is going to sound, he was very concerned with, you are young, you are 36, and you basically you want to do this. This is, and you're married. This is important to your husband.
Yeah.
And I'm just
Telling you
like,
what you needed.
Uh-huh.
Yeah.
Uh-huh. Sort of an
and
old
I'm like,
girl.
thinking back now, like, wait a minute, what if I don't? And my husband wouldn't have cared if I had nothing and I was flat and I did a prosthesis. He didn't care. He just wanted me here, and I'm
You're
here.
alive,
Yeah.
right?
But I was in total just autonomy,
Power.
like just go. I'm just show up. Just
Yeah.
yep, do whatever we got to do. Just
Yeah.
but looking back now, I wish I had taken a minute to know what these other options are
That's
now.
that's such good advice. I mean, I think it's so overwhelming at the beginning, and it's
Mhm.
like you're drinking from a fire hose, and I know like my experience, and it may be everyone's, because breast cancer in some ways it is so common. It wasn't for you at that age, at that time.
Mhm.
Nowadays, like 1 in 8 women, it's like I feel like everybody knows somebody who's been affected by breast cancer. But right
Right.
at the beginning, I had all these people coming out of the woodwork, like, you should talk to my cousin and my
Mhm.
neighbors and for once
Mhm.
whatever. And I mean, all these well-meaning people who
Mhm.
wanted to help, and their intentions were so good. But I was just overwhelmed with information and could not take all that in. And to your point, it's like I think if you had more time to process it, or to just even think, like if I could wait a couple months and then reach out to my
Yeah.
neighbor's cousin or whoever.
Right. Mhm.
I got to a place. I mean, at first I could not hear it, but I got to a place where I wanted to sit down with somebody and say, okay, tell me what you did and why, and what was that experience like for you. Then I almost could like interview people and understand the
Right.
choices they had made,
Mhm.
but it's very difficult to do that at the beginning.
Oh, so I mean, maybe this is going to be TMI, but so the lady I met from church, her daughter, or was it her daughter? Oh gosh, I'm going to get that wrong. We're still friends today. And she wouldn't mind me sharing this story. So I remember we met at a restaurant, and I mean, she was finished with chemo. She had done reconstruction. She did a different reconstruction. And I remember we left, we were talking, and I was just, you're just almost like you're just like glazed over, like I don't even know what's about to happen. And I remember we went out in the parking lot, and this is so funny. And she showed me her reconstruction.
It's happened.
Oh, it's
Yeah.
happened. I've had people take me
In
into
her
the
living
bathroom.
room.
Uh-huh.
And I was like, I want that.
Oh,
That's,
you do.
oh, it was like, oh, but that was not what I got.
Oh,
Oh
she.
no. And I'm like, so now I'm like, I wish I wouldn't have done that, because that was like in my head.
Construction.
It's like, no, yeah. So you can cut this out if you need to. But it's literally like, now I wish I wouldn't have seen that, because I'm like, well, I didn't get that. That's not how mine looks. Yeah.
Right, right.
But anyway, it
Yeah.
does.
It
I'm
happens.
here. And she's here.
I was
People,
gonna say, and that's the
people
good.
who are very happy with the results tend to want to show them.
That's true.
Yes, that's a very true fact.
That is, well, and these plastic surgeons, I always say they're artists. I mean, my plastic surgeon told me at the
Yeah.
beginning, he said, I cannot, I will not be able to give you what God gave you, but I'm going
Mhm.
to do the very best I could.
I could
And
do better.
I
Yeah.
literally had to fire him. Like I was like, I loved him, but he wanted to keep going back in
Yeah.
for review.
Oh,
And I was
Done.
like,
no, we're done. Yeah.
my husband doesn't care. I don't care. I literally
No.
just wanted to be able to buy a bathing suit, and go to the pool
Yep.
with my kids, and
Mhm.
not feel like a 10-year-old boy. That was my
Yep.
goal. I
Exactly.
mean, and I had to literally be like, I'm not coming back. I'm not going to go in your operating room anymore. Leave me alone. You know? So
That's funny.
anyway.
Yeah.
It's funny, but it's so true. It's
He
so true.
wasn't trying to make money. Like
No,
it's
he wasn't.
because they're trying, wanted her to be
But he's
perfect.
an artist.
Yes,
I
it
mean,
is,
he
yeah.
Right.
to be, he's like, well, and this is not exactly like this. And I'm thinking, well, it wasn't before. They
I
were.
know.
I mean,
Yeah.
heavens, I've had 3 kids. I breastfed them. Come on. Like,
And same. Yeah.
that's what
Sounds
it was,
fun.
Well, Candy, your story is so inspiring, and you mentioned the business and kind of the work that you're
Yeah.
doing now. So
Mhm.
give us a little, and we're going to delve deeper into that on a broad banter where we are talking to you and another couple of ladies who are
Mhm.
also survivors who have started businesses in this area, and we really are excited to learn more about that. But tell us what you're doing these days.
So I own a company. I've been up and running for about a year now. It's called Ribbons and Roads, and it is a mobile mastectomy solution company that I have a van that's wrapped, and I go do mobile fittings for women for after breast cancer, for bras and prosthetics, post-op camisoles, anything they need, and I do bill their insurance. So that's what I do, and it's going amazing. So
Fantastic. It sounds
and
like
I'm
a
doing it's in the Middle Tennessee area. And I would just, love to help anyone that needs it. Just give me a call.
and
Yeah.
what a breadth of experience you bring to the table, and just as a survivor too, that human element of really
Right.
understanding where they've been.
Well,
You're
I worked at Pretty in Pink and I did the fittings for them. And I just knew, there was a part of it that was like, there was so many patients that wanted they're like, can you come to me? Can you come to my house? Can you come to my, and I'm like, we just, that wasn't a service they offered. And
right.
I
Sure.
just remembered that. So when I started my company, that was what was important to me. So I've got a brick and mortar, I've got a location, but it's also being able to go in the privacy of their own home
Yeah,
to do a fitting for them it's so rewarding.
that's
That's
fantastic. So it's
wonderful.
ribbonsandroads.com is
Yep.
how
Yes,
people find
correct.
you. And then what would most people meet with you before surgery or after, or does it matter?
Either one, either one. Yeah. So, I mean, I can do a phone call, I can do a Zoom, if we want to do it beforehand. A lot of times the surgeon will have whether they can get it from me or the surgeon may have a post-op camisole. And then after that, if they want to get bras or if they don't do reconstruction, or even if they do reconstruction, it's not an exact science. And I have a partial prosthesis, I have full prosthetics, and the bras are covered regardless because it's the breast cancer diagnosis that makes them eligible for the items to be
Right.
billed to insurance.
Yeah.
Yeah.
Okay.
Well,
Well,
and
that's
like
wonderful.
I did radiation, so I had to wait like a year after that before I
Mhm.
could even proceed with reconstruction. So I
Mhm.
Okay.
all those items in the interim.
Right. Oh yeah, absolutely. Yeah.
I actually still love the camisole that I
Mhm.
bought,
Yeah.
the surgical
And it
camisole.
is,
It's very comfy.
yeah, it's different for every person. I had a deep flap reconstruction the same day that I had the mastectomy.
Right.
So I came home
Hmm.
with one of those abdominal binder things that sort of had something on top. So I had to wear that for several weeks. But,
Right.
everybody finds
Everybody
their
is
need. They
different.
figure out
Yeah.
when they need assistance. So
Sure.
ribbonsandroads.com is how you find
Yes.
Candy.
I think so
Hmm.
many applications, really. Yeah.
Absolutely. Absolutely. Well, we appreciate you. Thank you
Nice to
for the
chat
good
with
Well,
work that
you.
thank you
you're
so
doing.
much.
Loved getting to know you
Yeah,
more.
it's been fun to
Yeah,
chat with you.
thanks.
Thank you so much. Hope you have a wonderful afternoon.
Thank you. You too. Bye-bye.